Hello, dentist. How are you today? Today we're going to talk about a very important topic, which is the side effects of certain drugs. Patients coming to the clinic are on medication. You have to know the side effects of the drugs. This is really important. Okay, so it's very important to take a good case history and to ask the patient if he's taking any medication. And so today we're going to know the side effects of certain drugs. Like today we're going to talk about the Nifedepine. It's a calcium channel blocker. It is used as an antihypertensive agent, which is used for patients with hypertension. It can lead to gingival hyperplasia typically, and with red and puffy papillae with a tendency to bleeding. This means that patients with hypertension take this drug, and by time it will lead to gingival hyperplasia. Gingival hyperplasia means that the gingiva becomes swollen, red, puffy papillae, and has tendency to bleeding. Amitriptyline, this drug causes dry mouth with anticholinergic or sympathomimetic or diuretic activity, can cause dry mouth. So this drug can lead to dry mouth. Let's look at the slide now. The effect of nifedipine, it causes gingival hyperplasia. Can you see here the gingiva is swollen? Okay, it's red and puffy. Okay, and if on brushing, it will lead to bleeding. Either brushing or not brushing, it will lead to bleeding. So can you see it's very sensitive, really painful. Okay. Let's look at the other slide. Amitriptyline, this drug causes dry mouth. This is how clinically how does the dry mouth look like. Okay, so it's very important to ask the patient these questions. You have to ask the patient what type of drug or medication is he taking. Amitriptyline, they include atropine, hyoscine, antidepressants, phenothiazines, antihistamine, anti-reflux agent or omeprazole, opioids, and diuretics. Side effects of medication, like for example amoxicillin, penicillamine, and phenytoin. Let's talk about each drug independently. So we're going to talk about the antibiotics. Antibiotics are like broad spectrum antibiotics, like amoxicillin, can lead to Candida infections. Antibiotics sore mouth, GIT upset. So it can lead to the following side effects by time. Penicillamine is an anti-rheumatic drug which can lead to lichenoid reactions. Other drugs that can cause lichenoid reactions like gold, antihypertensives, and allopurinol. Okay, phenytoin is mainly used in treatment of epilepsy. It can cause gingival hyperplasia also, or enlargement, which is typically firm and pale. Other drugs can cause gingival enlargement, example nifedipine and cyclosporin, as we said before. Let's look at how does each one look like. This is the amoxicillin, the effect of amoxicillin. Candida infection in the mouth due to amoxicillin. Can you see how does the Candida look like? This is on taking antibiotics. Okay, this is called Candida infection. Lichenoid reaction due to penicillamine. Okay, can you see this here could be due to amalgam, or it could be gold or something like that. Okay, or certain drugs. Phenytoin causes gingival enlargement. This drug, okay, which is used for epilepsy. Can you see the gingival enlargement? Okay, and this leads to bleeding. The gingiva is swollen, okay, and really painful, and it will bleed on brushing, or either on brushing or on itself, and we call it gingival hyperplasia. This is another word for gingival enlargement. We call it gingival hyperplasia. So it's very important to ask the patient once when he comes to the clinic, what type of medication he is taking. because this will help the dentist to know exactly what it will help in the diagnosis and treatment of the case. Okay, so I hope that today's topic was interesting, and I hope this will help you in the clinic. So try, for my advice for dentists, young dentists, please try to learn as much as you can the side effects and the drugs, the side effects of